हेलो फ्रेंड्स, आज के इस वीडियो में हम देखने वाले हैं सेरेब्रो वैस्कुलर एक्सीडेंट दैट इज सीवीए और स्ट्रोक। तो हम स्टार्ट करेंगे वन बाय वन। फर्स्ट इज इंट्रोडक्शन। So CVA it is related to brain. So the brain is most complex part of our nervous system. It composed more than 100 billion neurons. Any deterioration in brain function leads to number of deficit in body function, and circle of Willis is responsible for blood circulation in brain. So the rupture of any artery related to brain leads to the CVA, that is cerebrovascular accident. Now we see the definition of CVA. CVA is sudden death of brain cells due to lack of oxygen caused by blockage of blood flow or rupture of any artery to brain. So there is a lack of oxygen or blood supply to brain causes CVA. A CVA it is neurological changes occurs in a brain due to disruption of blood supply to any part of brain. So blood circulation to the brain is very important for the normal functioning of body. So after definition, we will see the risk factors. So the first risk factor is medical conditions. It includes the high blood pressure, then heart disease, then diabetes and high cholesterol. This may lead CVA. The second risk factor is lifestyle factors. So if the person smoke, there is obesity, then physical inactivity means lack of exercises. This can lead to obesity, high blood pressure. So this may also lead a CVA. Now we see the causes of CVA, how exactly CVA occurs. The first is cerebral thrombosis. If there is a formation of blood clot in cerebral artery, so there is a less blood supply to brain. Then second, cerebral embolism. If there is a blood clot lodged in blood vessel, this may also lead to less blood supply to the brain. And third cause is cerebral hemorrhage. If there is a rupture of blood vessels, so this may causes the CVA, cerebral thrombosis, embolism and rupture of blood vessels. So after causes, we'll see the types of stroke. There are two types of stroke: ischemic stroke and hemorrhagic stroke. What is meant by ischemic stroke? It is blood vessels in brain is blocked, and hemorrhagic stroke means bleeding interferes with the brain's ability to function. So these are the two main type of stroke: if blood vessel block and if there is a internal bleeding. So this may cause a stroke. Now we see the clinical manifestation of symptoms. Those who person having stroke or CVA. There is a trouble speaking. There is a numbness, weakness or paralysis in face, arms or legs. Then problem seeing in one or both eyes, that is visual problem. Then headache, vomiting and dizziness, trouble walking and imbalance. So these are the clinical manifestation we can see in a CVA patient. Now we see the diagnosis, how we diagnose CVA. We can collect history from patient, then we can examine patient, that is physical examination. Then there is a CT scan, then MRI, cerebral angiography is done to see the any blockage in artery. Then there is a lumbar puncture and routine investigation, that is blood investigation. So these are the diagnosis. Now we see the management. There are three management: medical management, surgical management and nursing management. So in medical management, we give drugs to the patient. The first one is aspirin. It is emergency drug given to the patient to avoid another stroke. What is action of aspirin? It prevents the forming of blood clot. What is the dose of aspirin? The tablet aspirin 325 mg which is given orally. So this is the first dose. Second is intravenous tissue plasmogen activator. We call it as TPA. This is clot busting drug which is given IV within 4 to 5 hours after stroke symptoms begins. The dose is 0.9 mg per kg. So these are the medical management of CVA. Now we see the surgical management of CVA. For ischemic stroke, the first procedure is carotid end arterectomy, that is surgical procedure to open or clean the blockage in carotid artery. The second is bypass graft, means to create a new route to the blood flow around the blocked artery, and thrombectomy. It means remove the clot or thrombus from the blood vessel. So these are the three procedures. And second is surgical management for hemorrhagic stroke. The first one is surgical clipping. The clip is placed in neck to stop the bleeding. And second is surgical coiling. Coiling means long tube is inserted in the form of balloon and seal off the bleeding. Means to stop the bleeding, there are two procedures, clipping and coiling. So these are the surgical management. Now we see the nursing management of CVA. The first one is care during acute phase, then care during post-acute phase, then meeting the psychological needs, then rehabilitation and discharge planning and continuity of care. So these are the nursing management we should do stepwise. Under nursing management, there is a nursing assessment in acute phase and post-acute phase. The first one is in acute phase. How the assessment? The first is change in level of consciousness or responsiveness. We should assess in patient. Then assess the presence or absence of voluntary or involuntary movement or of extremities. Then stiffness or flacidity of neck. Then if there is eye opening, then size of pupils and pupillary reaction to the light, assess the color of face and extremities, temperature and moisture of skin, then assess the ability to speak, assess the presence of any bleeding, then assess or maintain the blood pressure. So these are the nursing assessment. Now we see the nursing assessment in post-acute phase. Assess the mental status, that is memory, attention span, perception, orientation, affect, speech and language. Then assess the sensation and perception. Usually patient has decreased awareness of pain and temperature. Then motor control. Assess the upper and lower extremity movement. Then swallowing ability. Nutritional and hydration status, skin integrity and activity tolerance, bowel and bladder function. Then assess the continue focusing in the patient's daily activities. So these are the assessment in two steps, in pre-acute and post-acute phase. After nursing assessment, the second step is nursing diagnosis. So these are the nursing diagnosis for CVA. First one is impaired physical mobility related to hemiparesis, loss of balance and coordination, spasticity and brain injury. Second is acute pain related to hemiplegia and disuse. Third, deficient self-care related to the stroke. Fourth one, disturbed sensory perception related to altered sensory reception, transmission or integration. Fifth one is impaired urinary elimination related to flaccid bladder, disturbed instability, confusion or difficulty in communicating. Next one is disturbed thought process related to brain damage, impaired verbal communication related to brain damage, then risk for impaired skin integrity related to hemiparesis or hemiplegia and decreased mobility. Ninth one, interrupted family process related to catastrophic illness and caregiving burden. The 10th one is sexual dysfunction related to neurologic deficit or fear of failure. So these are the 10 nursing diagnoses of CVA. Now we see the nursing intervention, that is next step. Now we see the nursing interventions. The first one is to give a proper position to the patient. Second, apply splint at night to prevent the flexion. Then prevent the adduction. Then prevent edema. Then provide full range of motion. Then prevent venous stasis. The next interventions are regain the patient's balance, help in maintaining the position, sitting, standing. Then personal hygiene, encourage the personal hygiene activities. Then manage the sensory difficulties in patient like vision or visual perception. Then visit a speech therapist. So these are the nursing interventions we should plan in patient. And the last one is nursing goal of a CVA. The first one is improve mobility and avoid of shoulder pain. Then achievement of self-care, relief of sensory and perceptual deprivation. Then prevention of aspiration of food. Then continence of bowel and bladder function, then improve the thought process and achieve a form of communication, maintain skin integrity and restore the family functioning. So these are the nursing goals we should achieve in a CVA patient, that is cerebral vascular accident. So these are the whole about CVA or stroke. I hope you understand the video. If you have any queries, then please comment, and if you really like the video, then do like this video and subscribe our channel.